Assembly last year passed SB 265, recognizing pharmacists as a healthcare provider. Without deferring to Medicaid, I want to hear your plans. What are your plans to integrate pharmacists into the care models so that we can emphasize value over volume?
So the goal that CareSource and all the other plans and ODM are working on together is to create a complete transparent model. Is pharmacists are the most important part of the equation, and people don't think about that. Pharmacists touch thousands and thousands of people every single day. So if you combine that, and one of the other things we're very, very excited about at CareSource is we're creating a command center, and that command center is going to take all real-time transactions. Pharmacy transactions are the most real-time transactions we have. And we're going to bring that information in, and we're going to know what's going on. We're taking it a step forward. We are going to pay for physician services allowed by law and engage the pharmacist in providing those services. In addition, we're going to do what's called MTM. So then we're going to take it one step further, and we're going to pay the pharmacist to provide an assessment. So we talked about the social determinants of health. We're going to ask them to do a very quick assessment that says, do you have a food insecurity? Do you have a housing insecurity? And we're going to pay them to feed that information to our command center, and then we might get a Meals on Wheels delivered to somebody's house. But what's more important for us, we're going to offer that service to every independent that is out there.
So yes, I'm excited. The passion that you can feel from Steve, I also would like to convey. We've actually been sitting down with OPA and as well as academia to begin to test exactly what Steve was just referring to. How do we model out a methodology to provide the pharmacist as a valuable part of the chain? How do we begin to look at them like a provider as a point of service? The pharmacist sees them. They actually have a relationship with them. So let's start thinking about how we incent that kind of engagement and bring additional value through the system and all the work that we're doing. It's very data-driven. We're working with OPA, I know Antonio's in the back, really trying to think through our next transformation of providing this, of adding value into the pharmacy space. And so I am extremely excited about the work that we're able to do here and begin to actually, I think, influence a different value proposition.
Are you allowing Caremark and CVS to still control your program?
Yes, actually, we are working with OPA to come up with a model. We're working on what are those best practices and how does that look. But we want participation from the pharmacy community. We don't want to do this in a black box. Actually, why we're working with OPA to do exactly that, and the independent pharmacists.
And I think a common theme you're hearing is that we are all very excited about the ability to leverage our pharmacists to the highest level of their licensure. And I think that's what the new bill is going to allow us to do. And this is an area where I think I'm hearing we're all working closely with the Ohio Pharmacists Association as the experts as to how can we do this well. Melina is doing the same thing, really wanting to understand specifically to the question on the independent pharmacists, how we can support them. So, and then lastly, I would share something that we are evaluating is specific in what I would call critical access areas. So your more rural communities, what do we need to do differently for those independent pharmacies? So really looking at a new model and opportunities to support those specific independent providers. So